So happy to see everybody, or glad that you could join us tonight. As you know, this is a monthly event that we have that's under the umbrella of creating a new mind. And so it's a very relevant topic that tonight Dr. Sepideh Taheri is going to talk about. So I'm just going to give a brief introduction of Dr. Taheri, and then I will pass it on to her. So Dr. Taheri is academic pediatrician, associated professor at Western University, and Doctor of Clinical Teaching Unit at the Children's Hospital, previously consultant pediatrician and honorary senior clinical lecturer at Edinburgh University. She is passionate about teaching and is actively involved in both undergrad and postgrad education of medical students and residents. She has a special interest in global health challenges and advancement of women. Please join me to welcome Dr. Sepideh Taheri. Dr. Taheri, it's all yours. Thank you.
Thank you very much, Hussein, for that kind introduction. I wonder if you could put me, Garen, as the speaker here so that my picture could come up. As I'm speaking to the audience. Maybe I could do that myself.
Yes, it's good now.
Is that good? Okay,
yeah.
Good. Good evening, everyone. So I would like to dedicate this talk to the memory of one of the greatest individuals who ever lived on this planet, Dr. John Ebenezer Esselmont, MBCHB FBEA, a physician, scientist, seeker of truth, author, visionary, whose life and work has inspired and will continue to inspire countless generations of physicians, healthcare workers, and people yet unborn to bring the vision of a physically and spiritually healthy humanity into reality. The topic of this talk is one that has rapidly become the predominant discourse and debate taking place in the contemporary world in view of a long expected yet little prepared for pandemic of catastrophic dimensions. Why? Because the very survival of the planet is being increasingly threatened. Yet surprisingly few people are asking the most relevant questions or looking for solutions that go beyond containing the pandemic itself. So global health challenges embrace a wide range of complex and daunting issues, from the international stage to the individual household, including the health consequences of poverty, wars and conflicts, climate change, natural catastrophes, and man-made disasters. Few people are either aware of the gravity of these challenges or have the tools to perform a root cause analysis to arrive at possible remedies. So in an attempt to delve somewhat deeper into this discourse during this very brief time that we have with each other, and I need to emphasize this is just an introduction to the topic and dealing with it. I will draw on evidence based on data from such institutions as the World Health Organization, the International Monetary Fund, the United Nations Development Programme, to outline the major global health threats of the 21st century, then apply a couple of scientific tools to determine the root causes of these challenges, and then using the scientific model of complex adaptive systems, offer insights from the Bahá'í teachings that identify the basic principles that need to be addressed in order to apply both short-term and long-term therapies to the numerous ills afflicting society. We will then explore at the end some research opportunities in the field, thus going beyond critique to constructive engagement with this fundamental issue as contribution to building healthier societies. So what are these global health challenges that the United Nations has and the World Health Organization has identified literally in 2019? The first one is climate change. 9 out of 10 people breathe polluted air every day in this in our planet. In 2019, air pollution is considered by the WHO as the greatest environmental risk to health. Microscopic pollutants in the air can penetrate respiratory and circulatory systems, damaging the lungs, heart, and brain, killing 7 million people prematurely every year from diseases such as cancer, stroke, heart, and lung disease. Around 90% of these deaths are in low and middle-income countries with high volumes of emissions from industry, transport, and agriculture, as well as dirty cook stoves and fuels in homes. The primary cause of air pollution, of course, is burning fossil fuels, as is also a major contributor to climate change, and also fuel from stoves is a contributing factor. Non-communicable diseases such as mental health disorders, diabetes, cancer, heart disease, chronic respiratory diseases are collectively responsible for over 70% of all deaths worldwide, or 41 million people. This includes 15 million people dying prematurely, aged between 30 and 69. And again, most of these, over 85% of these premature deaths are in low and middle income countries. And the rise of these diseases has been driven by 5 or 6 major risk factors, as outlined here: tobacco use, drug abuse, alcohol use disorder, physical inactivity, unhealthy diets, and air pollution. In this regard, I should emphasize that alcohol and substance abuse are closely related to the commission of crimes, road traffic accidents, family breakdown, major depressive disorder, schizophrenia, epilepsy, cirrhosis of the liver, and cancer. We actually were waiting for an influenza pandemic to occur very soon, but of course we were caught out by the fact that instead of getting an influenza pandemic, we got the novel human coronavirus, SARS-CoV-2 or COVID-19. And getting another global influenza pandemic is also a matter of time. We don't know when it will hit us and how severe it will be. Global defenses are only as effective as the weakest link in any country's health emergency preparedness and response system. Fragile and vulnerable settings, more than 1.6 billion people, so that's about 22% of the world population, live in places where protracted crises such as through a combination of challenges such as drought, famine, conflict, population displacement, and weak health services leave them without access to basic care. Fragile settings exist in almost all regions of the world, and these are where half of the key targets in the Sustainable Development Goals, including on child and maternal health, remains unmet. Antimicrobial resistance, the development of antibiotics, antivirals, and antimalarials are some of modern medicine's greatest successes and have led to a significant reduction in morbidity and mortality of not only children, but adults all over the world over the last century. Now, time with these drugs is running out. Antimicrobial resistance, the ability of bacteria, parasites, viruses, and fungi to resist these medicines threatens to send us back to a time when we were unable to easily treat infections such as pneumonia, tuberculosis, gonorrhea, or salmonellosis. The inability to prevent infections could seriously compromise surgery and procedures such as chemotherapy. Resistance to tuberculous drugs is a formidable obstacle to fighting a disease that causes around 10 million people to fall ill and 1.6 million to die every year. And the worrisome feature is that rifampicin, which is the most effective first-line drug, has developed a significant resistance pattern, with 82% of people now showing multi-drug resistant TB. And of course, drug resistance is driven by the overuse of antibiotics in people, but also in animals, especially those used for food production in intensive animal farming practices, as well as in the environment. Weak primary healthcare. Primary healthcare is usually the first point of contact people have with their healthcare system, and ideally should provide comprehensive, affordable, community-based care throughout life. Primary healthcare can meet the majority of a person's healthcare needs in the course of their life. Health systems with strong primary healthcare teams are needed to achieve universal coverage, yet many countries do not have adequate primary healthcare facilities. Communicable diseases and infectious diseases are not only spreading faster, they appear to be emerging more quickly than ever before. Since the 1970s, newly emerging diseases have been identified at the unprecedented rate of 1 or more per year. And this was at a time, actually in the 1970s, certain doctors and ID infectious disease specialists, they say we've conquered all the bacteria. There are no more microorganisms, no more viruses, no more diseases that we need to know about. We've conquered it all. We've now got antivirals, antibacterials, antimalarials, etc., for pretty much every single disease. And this is the end of the era of infectious disease. But they were so wrong because of a lot of things that I've mentioned already. There are now nearly 40 diseases that were unknown a generation ago. Many of these diseases spread in conflict zones, showing that the context in which an epidemic of a high-threat pathogen like Ebola, for example, erupts is critical. What happened in rural outbreaks in the past doesn't always apply to densely populated urban areas or conflict-affected areas. Many of these diseases lack effective treatments or vaccines. Vaccine hesitancy, the reluctance or refusal to vaccinate despite the availability of vaccines, threatens to reverse the progress made in tackling vaccine-preventable diseases. Vaccination, as you know, is one of the most cost-effective ways of avoiding disease. The reasons why people choose not to vaccinate are complex. A vaccine advisory group by the WHO identified complacency, inconvenience in accessing vaccines, and lack of confidence as key reasons underlying vaccine hesitancy. Let us remember also some of the additional health threats, including foodborne diseases, accidental and deliberate outbreaks such as toxic chemical accidents, radionuclear accidents, environmental disasters, and bioterrorism as additional threats that, although they lack slightly behind those other 9 or 10 issues that were mentioned, still pose quite significant threats to the health of our world and our populations. In addition to the above list, let us not forget the Millennium Development Goals, which were signed by the nations of the world in 2001, and were to be achieved by the year 2015, that's 5 years ago. It is clear that the reality shows the agonizingly slow progress towards these, the Millennium Development Goals and achieving these. So, the discerning observer is impelled to pose numerous questions as to the reasons behind this seeming paralysis of the body politic to work towards our set goals and commonly agreed goals. So here is where we can then examine some of the scientific tools that have been developed in the last few decades to try and come up with some answers. So root cause analysis is a structured method used to analyze serious adverse events. It is a tool for identifying prevention strategies. Initially, it was developed to analyze industrial accidents by the engineers. But this method, root cause analysis, is now widely deployed as an error analysis tool in healthcare as well. And a central tenet of this root cause analysis is to identify underlying problems that increase the likelihood of errors while avoiding the trap of focusing on mistakes made by individuals. This RCA, in short, uses the systems approach, which is again a new method in the world of science and mathematics of looking at problems in a much more holistic way and looking at issues in a systems way rather than an isolated, pinpointed, fragmented way. And one of the tenets of the root cause analysis to look at both the active errors, which means errors occurring at the point of interface between humans and a complex system, and hidden errors, latent errors, the hidden problems within healthcare systems that contribute to adverse events. And I'm using the healthcare system because if you want to approach global health issues, then that may be a way of approaching it. So as I said, the root cause analysis aims to define the problem. That's step 1. Step 2 is determine the causal relationships. Step 3, identify effective solutions. And step 4, implement and track solutions. It seems very appropriate. And then, of course, going deeper into it, you want to look at the basic causes that have led to the problem. You want to look at contributing causes, and you want to make sure that you put into practice and ensure that the human factors as well as related processes and systems are all taken account of, and that you analyze these causes and effect systems that can prevent those occurrences of those errors in the future. Root cause analysis has to be very highly interdisciplinary. You have to make sure that you involve the individuals at all levels, the community, and the leadership, the institutional leadership, in coming to some solutions in order to prevent future occurrence of those problems. Now, in root cause analysis, basic and contributing causes are discovered in a process that is very similar to the diagnosis of a disease, with the goals always in mind of preventing recurrence. So if you look at what I do and what many of us as physicians and healthcare workers do on a daily basis, is to look at the signs and symptoms of a disease and then try to find the root cause or the basic illness that is leading to the appearance of all these signs and symptoms. And I think this is a very important point to realize that applies to any problem that you want to address, not only in our individual bodies in a state of health and disease, but to any problem that is occurring in the world. So if you think about the major differences between signs and symptoms and the basic illness, here are some suggestions. Signs and symptoms, for example, of a child with meningitis. Let's say that this little boy has meningitis. He comes in with many different signs and symptoms. These signs are very visible. So the child is flushed, he's got a fever, right? He has a headache, he has photophobia, dislike of light, he's nauseous, he's vomiting, he has a rash, his neck is stiff, etc. So signs and symptoms are very visible. They are extremely tangible. You can feel it, you can see it. They are multiple, not just one. But remember that the signs and symptoms are secondary to the basic disease. And symptom therapy, such as Tylenol or ibuprofen and so on, or putting some lotion on the rash and so on, symptom therapy will only be partially effective. And that patient, of course, will deteriorate if the basic cause is not discovered and properly treated. But the signs and symptoms will actually completely disappear when the cause is found and cured, which is fantastic. Compare this, signs and symptoms, to the basic illness. Basic illness is invisible. You cannot see. This is the hugely magnified and colored, right, picture of a coronavirus, right? But you cannot see these. These are invisible unless you have an electron microscope that, we've only had for the last few decades that magnifies it hundreds of thousands of times. The basic illness is invisible to the naked eye. The basic illness is subtle. You cannot feel it. It's not tangible. The basic illness in pretty much most diseases tends to be one. It is single. The basic illness is primary and not secondary. And as I said, the patient will deteriorate if that basic illness is not found by a competent physician and treated correctly with the correct treatment. So please remember this slide. I think this is one of the most important slides I'm going to show tonight. And so in root cause analysis, what is often done is that you draw what's called a fish diagram. Okay, so these are all the bones of the fish, are all the possible causes: individual causes, community, institution causes, human factors, environmental factors, system factors that then lead to a particular problem and error. In this case, our global health threats. So you may say, these are some of the symptoms. So here are some of the possible symptoms and signs that many people that I talk to may enumerate, as well as many of our institutions, media around the world. They run off these whole number of symptoms and signs, and they say, these are the basic causes. These are the factors that are leading to all the issues. As I said also in the first sizes, conflict, war, poverty, culture of contest, intensive farming practices is probably responsible, pretty much responsible for most of our viruses and flu pandemics and measles and chickenpox and all the other things that we've had. Misinformation, media, fake news, all of this, excessive centralization in cities, political corruption, lack of truly global institutions, gender disparity, ingrained prejudices in people, cultural practices that are outdated and harmful to humans, lack of education, etc., etc. Many of my colleagues, people I talk to, the discourse in the society is largely around describing the signs and symptoms of a disordered, disillusioned, sick body politic of a sick world. And they say, these are the reasons, okay? So let's see if that is actually accurate. And very often, right, people then start asking even more questions as to why are the underlying, what are these underlying causes that are paralyzing us for going forward? We're on this small planet together. We have, so many people, we have so many resources. So what is the issue? And of course, we'll have lots and lots of questions, of course, going around in our heads. Many people will think, is it because of lack of material resources that we're in such a mess? Is it because of lack of human resources? We don't have enough people, we don't have appropriate institutions that can enforce some of these solutions and that we've come up with. Or is it a lack of general goodwill? What are the underlying issues? So let's deal with the commonest thing. Is it lack of money? We don't have enough money and resources. I hope that that what this slide shows us, and what surprisingly few people realize and appreciate, is that the only resource that is not lacking in our world is money. This slide illustrates this fact. The world's nations spent a combined $1.9 trillion on their militaries in 2019, which is the largest expenditure since 2010. And nearly 3 decades after the end of the Cold War, here around 1990, the greatest multinational industry in the world, the greatest amount of resources in the world, continues to be spent on armaments and for the destruction of the human race. So look at this. 2019, we are at higher levels of expenditure than we were in during the Cold War. This is a sobering realization. Followed closely by global drug trafficking market, estimated at about $500 billion, and that's probably the tip of the iceberg, together with all these other factors totaling $1.6 trillion to $2.2 trillion in all sorts of human trafficking, etc., and illegal trades. And this is a slide that's quite sobering. Again, if you think about the money that is spent on armaments and so on versus what is spent on far, far less important things in Europe, okay, and in the globe in terms of ice cream and cosmetics and etc., compared to what is spent on global priority goals such as basic education, health and nutrition, and so on, sanitation. This is these are sobering statistics that really we should be thinking about. So perhaps a more holistic approach. So if we wanted to find the causes of individual communities, institutions in a root cause analysis that has led to the major problems in our global health, you will have to put in innumerable fish bones in here. But perhaps a more holistic approach to solving complex and varied problems may require some more appropriate tools which look and take into account the complexity of what we're dealing with here. One such tool is using complexity science by viewing our global society as a complex adaptive system, a concept that has developed over the last 3 decades and has found increasing usefulness in affecting systemic change in ways that people conceptualize the functioning of systems. Okay, so complex adaptive systems have been described as a group of simple, self-organized, semi-autonomous, so almost sort of partly the agents that have some free will, okay, that interact together, okay, in a very interesting way to lead to the emergence of certain patterns, okay, to certain patterns. And these patterns then get some information out, and they can change the external environment. Then these patterns can produce a positive feedback, which amplify that pattern. And this change in external environment can bring information in, and the opposite can happen too. There can be a negative feedback, information in, there can be a negative feedback, such as a dampening effect on the behavior of these simple, self-organized, semi-autonomous agents. And that can again lead to information out through a negative feedback loop. Now, there are certain qualities, characteristics, and tenets of a complex adaptive system. One is that the whole is much more than the sum of its part. Okay. These agents are intricately interconnected and interdependent. Each individual agent is a complex adaptive system in itself, is itself a complex adaptive system. These agents in this complex adaptive system evolve with the system to which they belong because they're part of it. So think about, there are many examples of these complex adaptive systems: a human body, an ecosystem, a cell, a microorganism, weather systems, societies, immune systems, you name it, it is a complex adaptive system. Diversity is absolutely necessary for sustainability of the complex adaptive system, a key to innovation and long-term viability of that system. The CASs exhibit distributed control rather than centralized control, and outcomes emerge from a process of self-organization versus controlled externally. So it's not top-down, but it's bottom-up, grassroots up, how they interact, how they form these patterns, and then how that translates into the patterns of behavior in the society. And these are extremely important features. One other extremely important feature is that the effects and outcomes show non-linearity, means that small actions can lead to very big effects, what's called the butterfly effect often, that a little butterfly flapping its wings in somewhere in the, in South America can cause a hurricane in an ocean in Southeast Asia some months later, right? So it's not a linear relation. I give, this gives, it's not a linear one-to-one relationship, but it's a non-linear relationship. Small effects can cause exponential or massive effects that we don't immediately expect at all. And some other properties of complex adaptive systems is they have adaptive capacity, which leads to resilience to perturbation or disturbance, in order to be able to reinstate homeostasis, which means harmony, equilibrium, a state of moderation, a state of health. So if you look at, for example, a stem cell, for example, a stem cell is described as a pluripotent cell. So a stem cell can differentiate into any cell of an organ of the body. So a stem cell can become a heart cell, it can become a gut cell, it can become a fat cell, a red blood cell, etc., a nerve cell even. And what it decides to become and differentiate depends on the environment in which it's in, okay? These complex adaptive system within it, there has to be a huge amount of communication between the cells in that system, between the agents in that system, as well as cooperation, specialization, spatial and temporal organization, and of course, reproduction, which is absolutely fascinating. I wanted to show you a short video because I think that it will help us understand this concept. And it actually takes us very nicely to the next and concluding passages. I'll show you some slides after this, which is to do with some new teachings associated with the revelation of Baha'u'llah, which actually address very beautifully this topic and some possible solutions. I hope that this is going to work. Okay. So I hope you enjoyed that. So as I said, shared values lead to patterns of behavior that affect health, our thoughts, our experiences, our perceptions, our values, all interact to produce patterns of behavior. Now, over the last few decades, this principle of collective action, which means the coordination of all the elements within our world, has become the lifeline, the umbilical cord of the world, despite the fact that at once, not long ago, it was a pious hope. So how can we use this model of complex adaptive system to create a harmonious society and therefore health for all? And what are the best ways of affecting change in patterns of behavior in the citizens of the world, both on an individual level and collective level? And does an example of a healthy complex adaptive system exist in the world? These are the types of questions that we need to be asking. And so I wanted to bring your attention to some of the passages from the Bahá'í writings, from the teachings of Baha'u'llah, which address exactly these issues. Perhaps the most organic example of a complex adaptive system is the human body. This analogy is used repeatedly in the Bahá'í writings to explain multiple social phenomena in our world. Here's a picture of Queen Victoria in 1843. In 1868, Baha'u'llah addressed this indisputably most powerful monarch the world has ever seen in a tablet or in a letter which contains perhaps the greatest number of pieces of advice regarding governance of nations and peoples. Here, Baha'u'llah uses the analogy of the human body as a complex adaptive system to explain the root causes of the diseases afflicting the body politic. He says, regard the world as the human body, which although at its creation whole and perfect, hath been afflicted through various causes with grave disorders and maladies. Not for one day did it gain ease, nay, its sickness waxed more severe as it fell under the treatment of ignorant physicians, who gave full rein to their personal desires and have erred grievously. And if at one time through the care of an able physician, a member of that body was healed, the rest remained afflicted as before. Thus informeth you the all-knowing, the all-wise. We behold it, that is the body of the world, in this day. This is back in 1868, and this has become much more relevant with passing time. We behold it in this day at the mercy of rulers so drunk with pride that they cannot discern clearly their own best advantage, much less recognize a revelation so bewildering and challenging as this, referring to his own revelation, Baha'u'llah's revelation as the promised revelation of God, promised one of all the religions, the major religions of humanity at this critical time in our collective evolution. And Baha'u'llah then challenged world leaders to view the world in a holistic or an organic rather than a fragmented, mechanistic way. And he offered to create this organic unity by both offering causal therapy, which is creating true unity through a set of shared moral, or what some call spiritual values, which can become the foundation for a sustainable global civilization to which all the peoples of the world can relate to and embrace. He also offered symptom therapy, like Tylenol for the illnesses of humanity at this day, by offering them the way to a political unity, armistice, and ceasefire, and several other measures that the world's peoples could put into place, and the world's nations, to achieve at least peace, a political peace as well. However, Baha'u'llah, knowing that the rulers who were so drunk with pride and self-conceit that they would not accept the cure, even gave them this option of symptomatic treatment to avert disaster and great suffering. Baha'u'llah's successors reinforced this message, and the Baha'i international community, as it emerged gradually over the last century and a half, has repeatedly, through various agencies, shared with humanity at various different levels these options for both symptom therapy, as well as bringing into being a community where a new global society is actually being built from the grassroots. But unfortunately, humanity has refused until this time even to take this temporary measure, an end to war, an end to a culture of contest and conflict as a means of survival or resolution of disputes. Baha'u'llah's foreshadowing of the crises that are afflicting humanity long predated our collective experience. However, with every passing day, increasing number of individuals and institutions are realizing the indispensability of having shared values and shared vision of what it actually means to be human. What do human rights and social justice mean? What does unity mean? What does collective action look like? So you see from this report of the UNDP, when they talk about climate change, this is one of their headings, human solidarity in a divided world. So it actually goes beyond just putting in measures as to rules of what we should do to cut carbon emissions and so on. It challenges us to reflect on social justice and human rights across countries and generations. It, above all, challenges the entire human community to undertake prompt and strong collective action based on shared values and a shared vision. And these are not physical, molecular, financial. These are to do with a set of abstract, metaphysical principles, beliefs, values, and vision that are nothing to do with the very pragmatic and practical effects. And it's interesting that they said that the world lacks neither the financial resources nor the technological capabilities to act. Finally, we are getting at the root. People are realizing the basic illness. What is missing is urgency, human solidarity. That means unity and collective interest rather than fragmented, national, tribal, village, limited interest. And then, of course, the WHO, again, and many institutions since then have corroborated this view. As globalization accelerates, the interdependence of nations is perceived clearly. This is by the WHO World Health Report. Treating others justly is now both a moral imperative and an aspect of wise security policy. And the Baha'i writings long ago offered the fact that the working of the material world is merely a reflection of spiritual conditions. And until the moral spiritual conditions can be changed, that means the inner life of humankind, the way that we think, the way that we believe and think about reality. Until the spiritual conditions can be changed, there can be no lasting change for the better in material affairs. And that the universal crisis afflicting mankind today is therefore essentially spiritual or moral in its causes. And you have seen how the peoples of the world are beginning to come to that realization with every passing day. As we get more and more afflicted with more global issues, the pandemic being one of the latest, the most recent calamities that we are suffering from. The well-being of mankind, its peace and security are unattainable unless and until its unity is firmly established, said Baha'u'llah, over 130 years ago, 150 years ago. To this day, however, you will find most people take the opposite point of view. They look upon unity as an ultimate, almost unattainable goal, and concentrate first on remedying all the other ills of mankind, such as climate, such as global health threats, such as poverty, such as, you name it. If they did but know it, all the other ills are but various symptoms and side effects of the basic disease, disunity. This is from the Bahá'í writings. And so, friends, if we look at this model of a complex adaptive system as it applies to our global society, we are moved to think, does such a system exist? And here is where I would like to finish really with offering hope and asking us, inviting the audience to examine the Bahá'í international community as a model of a healthy, complex, adaptive system that is offering us hope, that can be studied by, and is increasingly studied by scholars, by decision makers, leaders, philosophers, historians, by people who really want to find solutions to creating a sustainable global society. Baha'u'llah said, true peace and tranquility will only be realized when every soul will have become the well-wisher of the entire human race. And I would invite you to look at the Bahá'í International Community's website, bic.org, and to see how the Baha'is in the Bahá'í communities, together with their neighbors, in neighborhoods, in villages, in cities, in remote communities even, are navigating this global health response. How are they responding to this around the world? And I would like to also invite us, those who are interested, to study how complex adaptive systems relate to health of individuals and societies. I think there's a lot of work that could be done in this, and we're really very new to this, so that we can go beyond critique of the situation to constructively engage in finding sustainable solutions. We can analyze what internal, external factors affect human health-related behavior. We can study how early introduction of moral principles or spiritual principles in child education can affect healthy lifestyles. And not last but not least, and is one of my pet subjects, is the role of women and future mothers and girls in the generation of healthy behaviors, which I think is absolutely central to this whole system of a harmonious system that we need to establish in the world. Ladies and gentlemen, thank you very much for your attention, and I will stop the sharing now. And if there are comments, questions, etc., then I'm more than happy to engage with you. Thank you.
Thank you very much, Dr. Taheri.